Hello and welcome to We Work Together, a podcast about people working in partnership to improve health and care across West Yorkshire. In this series, we're showcasing the West Yorkshire Staff Mental Health and Wellbeing Hub and hearing from people across the West Yorkshire Health and Care Partnership. In this episode, Dr. Connolly is joined by Dr. Clare Spencer, Dr. Amy Tatham and Laila Ahmed to discuss the menopause.
Welcome to this podcast, We Work Together, and this one is focusing on the menopause. My name is Connolly, I'm a GP and I'm based in Bradford. I have a passion for delivering women's healthcare and I have done for many years. And I'm joined today by three experts who I'm going to ask to introduce themselves.
I'm Dr. Clare Spencer and I'm a GP and menopause specialist and I'm based in Leeds.
My name's Amy Tatham. I'm a Bradford GP and I have an interest in women's health.
My name's Laila Ahmed, background's community work, and I do health engagement for the NHS and coordinate the Bradford Women's Health Network.
So over this next short time, we're going to discuss the menopause. We're going to discuss some of the clinical aspects. We're going to discuss some of the impact on women, and we're going to really explore how we can support women better, recognising the diversity of the populations that we work with, and also recognising the different experiences women will get from menopausal symptoms. International Women's Day is on the 8th of March, and this is a real opportunity for us to reduce the inequalities that exist for many women. And you will all, if you are a woman, if you live to that age, you will experience menopause. So getting it right for you and those you work with is really important so that we can continue to support women in the workplace. So first of all, I'm going to come to you, Clare. Can you explain to us a little bit about what the menopause is? Why do we have one? And there's also this confusion at the moment with the wording about perimenopause and menopause. And I wonder if you could just put some clarity onto that.
So the first thing is, what is the menopause? So, the menopause actually means end of monthly cycles. And for most women who are having regular periods, it's when those regular periods stop. I think it's really important to remember that it's a completely normal and natural part of a woman's life. It's a time of transition, really, where hormones are changing and our bodies are shifting towards the end of fertility. And it's a really important time because there is this sort of massive sea change in hormones. It's a really good time to sort of stop and take stock of what's going on. I think the second part of your question, Anne, as to why do we have a menopause? So little tiny bit of biology. In our ovaries, we have a certain number of eggs. And what happens every month when you have a monthly period is you pop a little egg called ovulation. And then if the egg meets sperm, then you can become pregnant. And if the egg doesn't meet sperm, then the egg just is absorbed into your body. And that's ovulation. And so eventually you run out of eggs, and that really is the start of the menopause transition. You start to run out of eggs and then you completely run out of eggs, and that coincides with your ovaries stopping making this really important hormone called estrogen. And then the third part of the question, then what about the perimenopause and the menopause? So the running out of eggs bit doesn't happen overnight. So it's more of a transition. So your ovaries gradually stop ovulating most of the time. Your ovaries gradually stop making the estrogen, really important hormone. And that's really the start of the perimenopause, where estrogen levels fluctuate, they gradually drop. You start getting symptoms of the menopause. And then the menopause is like a line in the sand. It's that time a year after your last monthly period. You wouldn't have known it was your last period. It's that line in the sand. And that's when your estrogen level is low and it stays low forevermore.
It's about that transition, isn't it? That time when we are functioning as fertile or potentially fertile women to then becoming well, to when the periods finish. You're absolutely right. And the time, the length of time of those symptoms can be terribly varied, can't it, for many women?
Yeah, no, absolutely. And so that the perimenopause, so the start of the menopause transition, can commonly start in your early to mid 40s and can commonly last 5, even up to 10 years for some women. So often you'll hear people say, oh, I'm too young to be having hot flushes, I'm too young to be in the menopause. But actually, you might be at the start of that transition. The average age of the menopause in this country is 51, but really it's an arbitrary cutoff, isn't it? Because what's most important are the symptoms, and they can start many years before that.
Yeah, really, really important point. So thank you. Amy, can you just come in then with a bit of information about the symptoms that women get? Because again, they're terribly varied. Some women get very mild symptoms, some women get very, very significant symptoms, don't they?
I agree, Anne. I think that the symptoms can be incredibly variable. And if you look in textbooks at the list of symptoms, often there's 30 to 40 symptoms listed. And I think the important thing to remember is that they are so varied, and every woman will be unique in the combination of symptoms they have or they don't have. So we think about a quarter of women won't have any symptoms at all, but the majority will. And as Claire said, the symptoms can often start in the perimenopausal period, which can be in the 40s, sometimes younger than that, but average age in the 40s. So I think it's important to help women to recognise their symptoms and put them together, because I think a lot of women struggle to see that that could be the cause of their symptoms. And I think, especially in the perimenopause, it doesn't just happen instantly. There can be real fluctuations in the symptoms. What are the common symptoms? What do we associate mostly with the menopause? So often there can be some change in your periods. Sometimes periods can become less frequent. Sometimes they can become a lot heavier and closer together. So it can be very variable. We commonly associate daytime and night sweats, don't we? What we call the vasomotor symptoms with the menopause as well. And they can be really difficult to manage, really troublesome sometimes. And they can also affect your sleep. And that can have huge impacts on your quality of life. I think also there can be more subtle symptoms that people can't always recognise in themselves for some time, such as mood change. Some people find that they can get really tearful. They might find that they get very anxious and stressed and short-tempered, and this can impact at home, but it can also have impacts at work as well. It's common that energy levels can be much lower. People will complain of aches and pains and also brain fog, needing to keep lists for everything, and just the inability to remember stuff that previously you wouldn't have had a trouble with at all. I think menopause can also hugely affect people's self-confidence, and sometimes that can be attributed to how you feel psychologically, but also weight gain is common through the menopause as well. Women often find that they gain weight, particularly in the middle, and become more apple-shaped rather than pear-shaped. And then there can also be the intimate symptoms that you can suffer with low estrogen levels as well, such as dry vagina and sometimes pain and difficulty with intercourse, and relationship difficulties that can result in as well. So, as I say, symptoms are so variable. I think it's been a lot easier for women to be able to recognise the menopause in more recent months with all social media interest that there's been in the menopause. It's a real hot topic, and there's been some great programmes and celebrities on social media that have been really speaking out about menopause. And I think that helps with people's recognition.
Laila, women often don't talk about women's issues, do they? There's a real taboo. They don't know who to talk to. They sometimes don't know, should they, is it what's wrong? Is it wrong? And then when can they come and say, talk to us or talk to colleagues or friends and family? Is there anything we can do as a network, as a system to support women better?
We did a call out to our members, mixed group of women across Bradford and Keighley. And I think within 2 weeks, we've been inundated by emails with comments, and you've mentioned most of them. I'd just like to add a few more of the concerns raised by women and these were women who'd gone through the menopause, were going through it, and younger women as well in the 20s and 30s. So around the physical element, loss of libido, hair loss, migraines, excessive bleeding. And this was mentioned by 4 women in particular as literally a whoosh. When we hear the word bleeding, we think heavy periods. But the word described was whoosh, where basically you can't sit down at work because the chair's covered, your clothes are covered. In terms of mental and emotional, there was a real fear around women losing their intelligence. So it's basically, we rely on our brain. It's been there in our 20s and 30s and teens. And then all of a sudden it's a click, and it feels, one woman described it as someone switching off the light, which was literally her intelligence and her brain. Several women had mentioned having to take 4 to 5 days off per month due to the symptoms. Many had very understanding employers, others didn't. Some had understanding families and others did not. But what really shone through was this transition phase. And I think if we were being soulful or spiritual, it was women coming to terms and almost mourning an essential part of their being. We had women who were grieving for decisions made, whether to have children, whether not to have children. It's such a huge transition, similar to adolescence, similar to our pregnancy periods, if we do decide to have children or are able to have them. And women's concerns were around saying goodbye to that part of themselves when the whole media and the industry around us dictates that being young and attractive and of childbearing hips is what a woman is all about. And I'll just finish with one quote by one of the members. On top of all the physical and emotional symptoms, it seems as if womanhood is slipping by, and I feel out of place with no control over it.
Those messages are so powerful, and thanks for the work you've done there. Claire, I'm just going to go back to you if that's okay. And let's get a little bit more clinical again before we go back to thinking about the impact and support. HRT, hormone replacement therapy, is in the news. Everybody ought to apparently be taking HRT. Do you want to just give us a little bit of overview about what it is and where it helps and where maybe it doesn't?
As you said, HRT stands for hormone replacement therapy. So in my rather long explanation about what the menopause is, one of the key changes that I spoke about was in estrogen, and the drop of estrogen, which is the main hormone made by the ovaries. It's not the only hormone, but it's an important hormone. It's the drop in estrogen, and really important, the fluctuation of estrogen, so the big swings that you can get in the menopause transition that can be responsible for so many of the symptoms that Amy talked about. So, particularly anxiety, hot flushes, all those psychological and physical symptoms, because there are estrogen receptors in so many parts of our body, in our joints, in the collagen connective tissue. Estrogen is really important. So hormone replacement therapy really aims to, it's sort of more of replenish. It aims to sort of top up and stabilize your estrogen levels in the perimenopause, in that early menopause transition. And then when you've gone through the menopause, when your ovaries aren't making any estrogen, it just aims to give you a little trickle of estrogen back into the system. And it really is, for most women, it's one of the most effective ways of managing those symptoms. It's not the only way of managing symptoms, but it is an effective way for most women.
Why is it people are concerned about HRT? Because it is right for lots of women, but not for everybody, is it?
No, exactly. So the issue with HRT is that there are some small risks attached to it. So if you swallow estrogen, if you take estrogen as a tablet form, there is a small increased risk of blood clots and stroke. What this equates to is, for most women, they'll go from a low risk to a slightly higher low risk. If you have estrogen through your skin, it doesn't affect your risk of blood clots or stroke. The biggest worry that most women have about HRT is breast cancer, and that's really where all the publicity has centred. A number of years ago, the early 2000s, a big study was published called the Women's Health Initiative Study. The results from that were sensationalised almost to really put fears into women about the risk of breast cancer from taking HRT. I think we've moved on from there now. I think what we understand is that there is likely to be a small increased risk of breast cancer from taking HRT, but it's likely to be lower with some of the newer types of HRT. And if you put that risk in context, for most women, the risk of breast cancer is greater from having a body mass index of 30 or above, so that's classed as obese, than it is from taking HRT. The risk is greater if you have on average 2 units of alcohol a day than taking HRT. So there is anxiety about taking HRT still. There is that small increased risk of breast cancer, but it really has to be put in context. And when you consider that HRT is an effective way for most women of managing symptoms, and also HRT, if you start it early enough in the menopause transition or under the age of 60, can help reduce the risk of heart disease. Really, it's a very individual decision, isn't it? It's not, management is not one size fits all. It's looking at the woman sitting in front of you as a doctor and looking at how those risks and benefits apply. So it's not straightforward, but yes, lots of anxiety, and anxiety still lingering about taking HRT. But it's important to understand how that sits in the context of other risk factors.
And I think the message for women is, if you've got symptoms and you want to talk about it, then go to your GP or your nurse at the practice and have a conversation so that you can understand on that individual basis, and then you can make the choices for yourself, can't you? That's the main message. Amy, I'm going to come to you with some more questions about how else we can support patients or women and what they can do to help themselves during the time of the menopause. We've talked about the mental well-being as well as the physical symptoms. So can you just sort of summarize about some of the other information you might give to women who come to you, sort of some self-help stuff, but also about how they can help themselves to live healthily post-menopausally?
I think when we think about living healthily post-menopausally, it's really important to try and lay down some of those good habits as women transition through the menopause. So things like looking at your lifestyle. So the quote, "You are what you eat," is so important. One of the common symptoms of the menopause is weight gain. So eating well is not just to help manage our weight, but I also think it helps to improve your self-esteem and how you feel about yourself. The other really important thing is exercise. The NHS advises that we do at least 20 minutes of exercise that gets our heart rate up every day. And I think it's important to remember that you don't have to join a gym. It's not everyone's cup of tea joining a gym. But even just getting out for a walk can really help your mental well-being, but also your cardiovascular health, your heart health as well. I also think it's important to talk. I see many women in primary care who will come in tears, perhaps in their early 50s, late 40s. They're finding work really stressful. They're struggling to cope. It's often a time in your life where you've got children who are growing up, moving away from home. Lots of women in that sort of age might have aging parents or parents that are becoming more dependent on them. And I think it can be a real time as well with the hormonal changes, lack of confidence, your weight and your body's changing with all these hormonal fluctuations. And it can be a really, really tough time. So it's important to share your worries and to share how they're feeling. And I think that can help hugely when it comes to managing stress. And then there's also the practical bits, isn't there? So we talked about one of the common symptoms being night sweats and the day sweats. So wearing cotton clothing, layering what you're wearing so that you don't overheat and you can shed your layers. Having a lighter duvet. I think there's a real market out there, isn't there, for a duvet with a thick side and a thin side. I've heard patients say that they've found buying a fan for the bedroom absolutely life-changing. And I've seen women at work with USB fans plugged into the computers as well to keep them cool while they're working. I've heard you, Anne, say as well, keeping a frozen bottle of water in front of your fan in your bedroom can help to blast you with cold air. So a few practical tips there as well. We also know that there's some triggers for sweats too. Alcohol doesn't help. And I'm not saying don't drink alcohol at all, but everything in moderation. Spicy foods and caffeine as well can also be triggers. But really, I think diet and exercise and things you can do to help recognise stress and reduce stress levels are so important.
Laila, I'll come back to you. What else can we do? What is it women want us as healthcare professionals and colleagues at work and employers? What is it we can do to support women better?
I think some of the key messages and themes that have come through are that it's not a one size fits all. Some of the women went through the menopause and required no medical intervention at all. Others did. At a community level, there's definitely an ask for more opportunities to have those very open, honest conversations with other women and persons around the menopause. So the menopause cafes, there's been poetry sessions for South Asian women where they've actually combined poetry with discussing their feelings and emotions around the menopause. So there are quite creative ways to do this in very local settings. I think the ask from medical and health professionals is that women and persons who menstruate, when they do go to the GPs or to a health professional, that they're actually listened to and acknowledged. So they may come due to the symptoms with a very long list of issues, but the fact that those are acknowledged and not dismissed, that medical advice is provided when required. And I think a key fear for a lot of our members was around going to the GPs with excessive bleeding, with terrible migraines, and being given a prescription around stress and anxiety. So that was a concern and a perception. Having said that, the number of positive experiences mentioned by members was vast. There was a query rather than an ask, and that was around training and advice for GPs and health professionals. I think our medical environment in 2022 is very different to what it was in 1990, and the ask that our health professionals are supported and encouraged to keep up to date with those findings, because a lot of women are really up to date with it. They are doing the research, that they are Googling. At the same time, I think it's really important to bear in mind that we're not all on a level playing field. So through some of the menopause cafes we delivered, we've spoke to several women, not necessarily South Asian, some were white working class, some were Eastern European, who when we use the word HRT, it was like, well, what? I've never heard of it. So it's just being aware, we are using these words, we may be aware, but we can't presume that everyone else knows what those initials mean. So I think the key message is around being listened to and being acknowledged.
Yeah, it certainly has from a healthcare professional need. And in the workplace, I guess women are wanting to be able to feel more confident about talking about their issues.
I mean, some of the key words coming forward from women across different professionals and non-working women was the word around feeling embarrassed. So it's almost removing that veneer of embarrassment where we can openly share. And then it is at a more macro level in terms of health interventions, support and advice that's accurate and up to date.
Thank you very much. We are going to see over the next year a lot more coming out from the central NHS about menopause, and there are three things that are going to come out which Laila, you've just really picked on. One is going to be about appropriate information for women and for all women, with a real ambition to reduce inequalities. The next piece of work that's coming out is about healthcare professional education, because you are absolutely right that there is a need to improve everybody in health's information about menopause management, because we still have lots of conflicting evidence out there, which makes it quite confusing for most GPs and primary care workforce. And then the third piece of work that's really important is coming out about workplace support. So looking at what can be done in the workplace to really improve the care and support that women are getting. And that might be about being more flexible with working. So we're coming to the end of this podcast. Thanks so much to Clare, Amy and Laila for their input to this. For me, the message has come through from all of us, look after yourselves. And if you're not the person going through the perimenopause or the menopausal symptoms, then support those who are. Let's support women, because it's important that we start to talk better about it. And then by doing that, we can reduce the psychological issues as well as the physical issues that many women are experiencing. Now, there's some great information out there to have a look at. This lots, which is put on the menopause resource page on the West Yorkshire Workforce website. There's some free online sessions. There's some useful links. And the Primary Care Women's Health Forum have a fabulous website called Rock My Menopause. And on there's lots of self-help information, and there's more about what we've been discussing. So there's information about HRT, there's information about self-care, there's information about how to relax, etc., etc. Thanks to everybody who's helped us with this podcast. Clare, thanks so much for your help with this.
It's really lovely to be involved. Thank you for inviting me.
And Amy,
thanks for including me in this. It's really great to get some of these important messages out there, isn't it?
And Laila, thank you so much for all the work you do helping promote the messages that women find it so hard to get the answers to, and to make us as system leaders so hard to get right. So Laila, thank you.
Thank you, Anne, for the opportunity to share some of our community's concerns and voices. Thank you.
You've been listening to We Work Together from the West Yorkshire Health and Care Partnership. For more information on the Staff Mental Health and Wellbeing Hub, please visit workforce.wyhpartnership.co.uk. Join us again next time, when we'll be joined by more people who work together to improve health and care for people in West Yorkshire.